It's really nice to see everybody here for this workshop. I wanted to say a few things this morning. Nye County has had a real bad budget problem this year. We even thought, some of us prompt commissioners, that we was going to lose this whole department because of the budget cuts. The brothel industry stepped up to the plate and said, we'll double our fees so that we can keep veteran services open. So that's around, what is it, $120,000 a year? Yes. That's enough that I can keep Ken employed and working. The problem of it is I don't have enough money to put 2 more people that we originally had back to work. The problem of it is this program was only supposed to be for 3 years. The state gave us $300,000 to institute this program, and we were to take Esmeralda, Northern Nye, and Southern Nye. The problem was that after 3 years, the county went ahead and continued the service up until now, and we're still doing it with the staff that we have. Brandy is a volunteer. We're sending you to school, right, Brandy?
Yes, sir.
She's going to be going to school to get upgraded. My wife, Geneva, she puts in 2 days a week and more if Ken needs her. And I just want you to know to be patient. We know that you need to see Ken. Ken has medical problems too. He's a veteran, and he has his problems, and we all do. I have mine. You know, when my claims don't get put in right, I ask him, and he said, well, Commissioner, you're just going to have to wait your turn. And I have to wait my turn. So I just want you to be patient with my staff. They're working hard. And if you have any questions, my office is open to you. And I just, you know, we take care of one another.
Thank you, Commissioner. If I may add just a quick word. Commissioner Hollis is a veteran himself, and he has actually told me that if he doesn't utilize the service, how does he expect the veterans to utilize the service? So he actually sought me out and decided to start using the services that are provided by Nye County. So he expects each one of you to at least check out the services that are available to you, because we're providing them for Nye County.
Thank you very much.
Good morning, everybody. Sorry, I got my neck brace on. As Commissioner Hollis was saying, I'm a disabled veteran. I served in the Marine Corps. I'm having a few health issues myself, thus the neck brace, and the back brace, and the cane. So excuse me if I don't look directly at you. I may turn and glance at you from time to time, but I'm going to be focusing most of my time at the screen today. If I may just do a couple of house cleaning items here. If everybody can take their cell phones and place them on vibrate or off, that way we don't have any interruptions during this class. If you need to leave during the process of this class, that is okay. Just please do it quietly so you don't interrupt the others while they're trying to learn the information. The purpose of this class is to inform the veterans of the benefits that are out there. As Commissioner Hollis has stated, that this is for Nye County veterans, and I also cover Esmeralda County as well. And as he mentioned, my office was cut on staff. I am the only accredited service officer in Nye County and Esmeralda County, which leads, Nye County is one of the largest counties in the United States. And when you combine that with Esmeralda County, we have close to 21,000 square miles that I have to cover. In that 21,000 square miles, there's approximately 9,000 veterans in that area. So I find myself with my time spread very thin, trying to get out to the rural areas, to those veterans in the outlying areas, all the way up to Gabbs, which is about a 6-hour drive one way. So you can kind of see, as your appointments get spread out 6-8 weeks out, it is very difficult to to get in and see me. So it is very important to be patient. Just on another note with that, if you do go down to Las Vegas to seek their services, the state office is looking about 8 to 9 weeks out just to get an initial appointment. So one of the reasons why I came up with this class is to get as many people in the room as possible and explain the benefits, because I take about half of my day and explain the same, I guess, spiel over and over about what benefits am I eligible for. So if I can get as many together and explain what benefits are out there and dispel those rumors of what is eligible, what are not eligible benefits, now I'm doing my job. I'm getting the word out to the masses. Now you can get your documents in order, and when you come down to see me and you actually have your appointment, we can actually take some action and do some paperwork. Because if you come in and see me and we take 2 hours to talk about what your benefits are, now we have to set another appointment 2 months out to go get your paperwork, come back and start the process. So this is actually your first appointment with me. With that being said, I kind of like to go into my little disclaimer here, and I do this just to kind of cover my behind a little bit. The information in this site is for general purposes only. The application of the laws can vary widely based on the specific facts involved. Given that the changing nature of the laws, rules, and regulations, they change on a day-to-day basis, there may be delays, omissions, or inaccuracies from the information in this site. I have made every attempt to make sure that the information in this site, even up to last night while I was updating it, has been obtained from reliable sources. Nye County Veteran Services or its staff, which right now is just me, is not responsible for any errors or omissions or for negative results from the information obtained from this class today. Each claim is unique, and this is very important to understand. Each claim is unique, oftentimes with different circumstances which may affect the result of the claim. Two people may come in with the same exact shoulder injury, but they're not exactly the same. There's a different set of circumstances behind those shoulder injuries. Please understand that my office is here to help you with your VA benefits. We are not employees of the VA. However, we are accredited with the Department of Veterans Affairs in helping you get your VA benefits. What does that exactly mean? That exactly means that we are accredited and acknowledged by the Department of Veterans Affairs to help process the paperwork and act as your advocate to fill out the paperwork and help you with your VA benefits. Right now, I have 16 different accreditations through the Department of Veterans Affairs. Most service officers have 1, maybe 2 different accreditations. So with somebody with 16 different accreditations, it really has a lot of backing to it. The goals of our office are to inform and educate the veterans of the benefits that they may be entitled to. Thus, which is why we're here and why this class is being performed today. I also wanted to let you know before we got too much further, this class is being videotaped and is going to be on the internet and be distributed by DVD. If anybody does not want to be on the internet or on the DVD, you should probably excuse yourself now. We actually assist veterans in filling out VA claims, and what my office does is we do not hand you a form and tell you to come back with it completed. My office actually takes the time, asks you the questions that are on the form, and actually completes those forms for you, and kind of plays 20 questions with you to get the information that the VA is looking for. Once those forms are completed, the veteran signs those forms and we turn them into the proper departments. We give aid, assistance, and counsel to problems, questions, and situations relating to veterans' benefits at the state level and the Department of Veterans Affairs. We also research claims, case laws, and regulations, and medical opinions to develop the best strategy of action to file a notice of disagreement and hearing requests. we take this all the way up to the Board of Veterans Appeals if they deny your claim. So we do a lot of different things in this office, and we're here to help you. So if you let us and follow our steps, we are very, very successful in this office. We also review assigned claims made available by the local rating board on a regular basis to help with the Veterans Benefits Administration of the Department of Veterans Affairs. What does this mean to you? Basically what this means is I look at the VA laws and regulations on a day-to-day basis, see if any laws have come out, anything has changed that is going to help you with something that you may have been denied for in the past, or something that you have currently pending, or something that may end up hurting you down the road. So that's what our main objectives and goals of our office are. We're going to get into general eligibility. You're going to hear a lot about general eligibility through the whole process of this claim. General eligibility plays a huge factor on what benefits programs are out there and available, and who is eligible for the program. Eligibility for most VA benefits are based upon the type of discharge. And if you have a dishonorable discharge, you're pretty much barred from most VA benefits. But if you have anything other than a dishonorable discharge, there may be wiggle room in there. If you have an honorable, you have absolutely nothing to worry about. Active service for full-time service means other than active duty for training as a member of the Army, Navy, Air Force, Marine Corps, or Coast Guard, or the other ones listed down below. And they get pretty wordy as the National Oceanic Atmospheric Administration. I generally don't see too many of those people that come walking in my doors, but they are eligible for the same VA benefits. So if you know anybody who worked in any of those departments, they are eligible for VA benefits as well. Generally, men and women veterans with similar service may be entitled to the same VA benefits. However, all of us in this room know that men and women don't have the same body parts, so therefore some things can be a little bit different. Dishonorable and bad conduct discharges issued by General Court Martial may bar you from VA benefits, and it generally does. Veterans in prison and parolees must contact the VA regional office to determine eligibility, and the VA benefits will not be provided to any veteran or dependent wanted for an outstanding felony warrant. So if you're wanted for a felony warrant, you might want to get that cleaned up before you come into my office and see me. Because if you have a felony warrant and we've turned this paperwork into the VA, they're going to do some research on you and find out where you live and come and get you. The other big thing we're going to talk on here is a wartime service. And you're going to hear this throughout the rest of the presentation as well. Wartime service means that you served during a period of war, and that is going to be part of the eligibility process. Serving during a period of war does not mean that you actually went over and fought during the war, but you were on active duty at least one day during one of these periods that I'm about to list. World War I, the last World War I veteran just passed away just a few months ago, probably almost a year ago now. So World War II was December 7th, 1941 through December 31st, 1946. So if you served one day during that period, you are a wartime veteran. The Korean War, or Korean conflict as it's often known as, is June 27th, 1950 through January 31st, 1955. The Vietnam War was August 5th, 1964 through May 7th, 1975. However, if you were actually in country of Vietnam and can prove that you were in country between February 28th, 1961 to August 5th of 1964, you are also considered a wartime veteran. And a lot of people don't understand that in country means that you can prove that you actually stepped foot, boots in ground, in country, have some type of orders or something that proves that you were in country of Vietnam. And if you have that, you are considered a wartime veteran. And the last one we have here is considered the Gulf War veteran, which is August 2nd, 1990 through current day today. When they set the Gulf War in August 2nd, 1990, when they declared war, Congress has never declared that that war has been over. So anybody who has served since August 2nd, 1990 through current day to day, they have never declared that the war is over. So anybody from 1990 to today is a wartime veteran. And they don't use the term Gulf War right now. They have changed since the wars have kind of changed and developed. Gulf War, Persian Gulf, OIF, OEF, Global War on Terror. There's several different terms out there, and it can get very confusing, but the normal term is Gulf War for this period right now. And all of these dates were set by Congress on when the war was actually declared and when it was actually over. So that's how they came up with these dates. Disability compensation / service connection. This is the biggest program that I deal with on a day-to-day basis. Disability compensation and service connection are basically the same terms used interchangeably. Disability compensation is a monetary benefit paid to veterans who are disabled by an injury or disease that was incurred or aggravated during active military service. Now, what does that mean? Let's say you're driving a Jeep in Vietnam, the Jeep rolled over and you ended up breaking your arm. Well, that was something that was incurred or happened to you while you were on active duty. If you suffer from problems today from that broken arm that you flipped over in Vietnam while you were on active duty, that can also now be service connected. An aggravated condition may be something where if you went into the service with a pre-existing injury, an asthma condition, they signed a waiver, said it's okay, you have an asthma condition, but doing all the physical activity made your asthma condition worse. Now it is called aggravation. We can also get that service connected as well. These disabilities are considered to be service connected. There's a couple of other ways to get items service connected, such as secondary items, and I'm not really going to touch into that quite right at this point right now. Disability compensation varies on the degree of disability, the number of dependents that you have, and is paid on a monthly basis. And these benefits are not subject to federal or state income tax, so it is all tax-free income. So if they come back and say, oh, that broken arm that you had or that asthma condition that you had in the service is rated at 30%, you're entitled to $376 a month, you don't have to report that on your taxes every year. To be eligible, the service of the veteran must not be terminated through separation for under conditions other than dishonorable. Here we go, that dishonorable discharge again. You're going to hear that through the whole process, as I mentioned. Veterans with at least a 30% rating get additional money for their dependents, which include their spouse, their minor children, children between 18 and 23 who are attending school, or children who are permanently incapable of self-support because of a disability arising before the age of 18, and dependent parents. And these are all ifs, ands, or buts on those last things that I added on there, the children who are in school, the children who are incapable of caring for themselves, and their dependent parents. There's additional rules and applications that apply to that. And each one of these things you have to fill out a different form for, which is why I'm here. I can help navigate those forms and fill them out and get them to the proper VA facility. The amount of money you get depends on the disability rating. So it goes up on how much you get depending on your disability rating. Veterans with certain severe disabilities may be eligible for special monthly compensation. What is a special monthly compensation? Special monthly compensation, let's use a veteran who was in Vietnam and had prostate cancer due to Agent Orange exposure. Well, if they cut your prostate out and you had a loss of a creative organ now, the VA is going to pay you for the loss of a creative organ. That is called the special monthly compensation. They're going to pay you additional money on top of what they service connected you for because of the loss of creative organ. Same with women. If they have a loss of a creative organ, or something, if you had that Jeep accident and they had to amputate your arm, they will pay you additional monies for special monthly compensation because of a loss of a limb, a loss of eyesight, loss of sense of smell. certain special things like that will pay additional monies. Here's the current 2011 disability compensation rate. I'm going to talk about this for a minute. If you look at the very top here, 0% means $0. A lot of people look at that and they get discouraged and they think 0% is not worth anything. 0% is a win. And it's a huge win. I'll tell you why. Because anything that you get service connected, you get full health care for the rest of your life through the Department of Veterans Affairs. So if you have that asthma condition that is service connected and they say it's not great enough to pay you a money amount for, but they give you a 0%, now you get treated by the VA for free. You go in, you have no copay for that asthma condition. So no doctor pay. They give you a bronchodilator or inhaler to breathe on a daily basis. That is free. Prescriptions are free for that. If you have to get put on an oxygen machine because your condition gets worse over time, they pay for that oxygen machine and oxygen that gets delivered to your house. It is free for the rest of your entire life. It is a big, big deal. Don't let 0% fool you. Even though you don't get a monthly benefit, it is a big deal. As you get higher down the list, 10%, you get $123 in your pocket every month. And as you go down the list, and this is for a single veteran right here, by the way. 100% right now for a single veteran is $2,673. And then you add on, if you're married, a dependent, it goes up approximately another $200. And then you add children on there, it goes up a little bit more. So it can go up quite a bit. You can get $3,000 or $4,000 at 100% with special monthly compensations, dependents, and children. It can add up to quite a bit of money in your pocket every month. I'm going to talk a little bit about the programs for veterans with service-connected disabilities. I know a couple of you approached me before the class began and wanted to know about some of the programs if they were service-connected. So I'm going to talk about those now. One of the programs is vocational rehabilitation. The rehabilitation program basically states that if you have 20% service connection and it has an employment handicap, or you have a 10% service connection with a serious employment handicap, the VA will put you back into college and retrain you to get you back out into the workforce. This program is meant to retrain you to get you back employed again. This is not to go back to school and learn a trade and just be retired. They ask you, what do you want to be when you grow up? You jump through a lot of hoops and see if there's going to be a job available after you graduate from college to actually get out in that work field. I am actually a product of the vocational rehabilitation program. They asked me what I wanted to be when I grew up, and I told them I wanted to be a computer programmer. I actually had to get on the phone, talk to computer programmers, talk to them, see if that's what I wanted to do. They made me jump through a whole bunch of hoops. Finally ended up getting accepted through the program. I got my degree in computer programming. However, when I got out of computer programming, they needed 5 years of service of active programming, so nobody would hire me. Lucky for you, Nye County hired me. I think. So there's also other programs that go with the Voc Rehab program, and one is the Work Study program. If you're going back to school, 3/4 or full-time student, you can actually work for an entity like myself or another VA facility and come do some answering the phones, do some data entry, do some filing, and if that is done and there's a slow day, you can actually crack open your books and do your studying. That's called the Work Study program. Brandy right here is an example of that. She is currently going through the Work Study program, and she is helping through my office. What the program, the way it works, is the VA actually pays you a stipend for working. Every 50 hours you turn in a pay stub to the VA, and the VA cuts you a check for the time worked. So you're actually getting paid for the work study. You get on-the-job training, and when you get your vocational rehabilitation, when you get your degree, now you've got extra job training to get out in that workforce and have job skills to go along with that degree you just have. It's a great program. I also use that program, and it helped me out tremendously. The Specially Adapted Homes program, there's a lot of ifs, ands, or buts to this, but I'm just going to generally touch topics on this. It is used to buy or upgrade specially adaptive homes or home to meet their disabilities. And there are related requirements. And if you needed a ramp to get up in there because you have a wheelchair, or you needed to lower the tables in your house because you're in a wheelchair, or they actually have grants out there for bathroom adaptation, to raise the toilet seat up, to put handles to get in and out of the bathtub, to get in and out of the shower. So they do home modification loans. There's HISA grants. There's a couple different programs out there. Some of them are about $68,000 right now, and some of them are about $4,100. There's several different programs, but they are available out there for the veterans with severe disabilities and handicaps to help them meet their daily living needs. There's also automobile assistance, and to qualify for the automobile assistance, you have to have a loss of a limb or loss of movement in a limb. So if you need that little knobby on the steering wheel to help you turn the steering wheel, that is one of those programs that is out there to help you. I'm going to jump down to the next one, which is the clothing allowance. The clothing allowance is a yearly allowance you have to apply for every year. The way that program works is, let's say the VA gives you a knee brace because you had a total knee replacement or you have a bum knee. If that knee brace starts wearing holes in your jeans and your clothes, well, now the VA is going to pay you on a yearly basis. I believe it's about $800 and some odd dollars right now per year to go out and buy new clothes for the ones that they're wearing the holes in. It also applies, that I see a lot of times, is lotions and potions, and it applies to Vietnam veterans who come back who have skin rashes and things that they can't diagnose, and they throw potions at them and they rub it on their skin and it discolors their clothing or eats a hole in it because of the lotions that they're putting on. So they can apply, and there's several different criteria, but that's just two examples of how the clothing allowance works. But you have to apply for that every year. The aid and attendance and the housebound. The aid and attendance and the housebound programs, the aid and attendance part, you need the assistance of another person. And the way that wording actually works is you need the assistance from another person for your normal daily life functions. And if that daily life function is getting out of bed, getting dressed, bending down, tying your shoes, using the restroom, wiping your tushy, taking a bath, taking a shower, doing those sort of daily activities. And if you cannot do those functions on your own, we fill out a request by a doctor. Once a doctor fills out the form saying, yes, the applicant cannot meet this criteria, then we turn it in to the Department of Veterans Affairs, and they come back with a yes or no. The housebound is for somebody who is permanently housebound, like somebody who is legally blind, or somebody who has Alzheimer or dementia, who if they left their house is a harm to themselves or a harm to somebody else. And as you know, we live out in the desert, and sometimes it can get 115 degrees outside, and if somebody has dementia or Alzheimer, they left the house, they go wandering out in the desert and forget where they live. They're going to end up dying from heat stroke, so they could be a danger to themselves. So we're going to apply for housebound and get some extra income for them, to help get somebody to watch over them full time. The last one on this list is combat-related special compensation. A lot of criteria you have to meet on this, but it's a really cool program if you meet it. In order to qualify, you must be retired or receiving retired pay. You must have 20 years of active duty or be a reservist at 60 years of age with 20 years of service and have a VA disability of at least 10% or higher. And it says you have to go through the Social Security office to apply. However, I do have those forms on my desktop, so I can get those to you. We fill them out and we can send them directly to DFAS, and they can look at that and do a pretty quick turnaround time. And what they do for that program is they actually pay you, if it is combat related, they will pay you the VA disability on plus your regular military retired pay. The way it works right now is if you're a retired veteran and you file for compensation and you get compensation, they take away dollar for dollar from your military retirement. However, the compensation is non-taxable. So you're going to end up making more through the VA because it's non-taxable. So you'll actually get two checks. A little bit confusing. I can probably answer that better for questions and answers later. This next slide, non-service connected pension. This is probably the second biggest program that I do in my office. I want you to take a look at that money down there in the bottom corner. Closer. I'll get closer. The non-service connected pension, I want you to really pay close attention to that money down there in the bottom right-hand corner. Whenever you're talking about a pension program through the VA, you're talking about a money benefit. So whenever you're talking money benefit, the VA takes away dollar for dollar what you earn, or what the house earns, household income. So let's go through this a little bit. Non-service connected pension is a VA benefit program that provides financial support to wartime veterans. You notice wartime is in bold and highlighted there, having limited income and who are permanently and totally disabled or over the age of 65. What is permanently and totally disabled? Permanently and totally disabled means that you cannot seek and hold gainful employment because of a disability. It does not have to be related back to the military. If you were walking across the street and got hit by a bus and that caused your disability, and now you did not meet this income status and you did have wartime service, you are now eligible if you meet the income standards. Or if you are over the age of 65 and meet the income standards and have wartime service, you're automatically eligible for this program. This program is used to get your standard of living up to where you can put a roof over your head and some food in your mouth until another program comes along. This program is not meant to make a living and make you a millionaire. It's meant to get by until something else comes along. The amount payable under this program depends on the type and the amount of income the veteran and family receives from other sources. They take all of household income. So if you're married, they take your income, your wife's incomes, and let's say, well, you have an 18-year-old daughter that's living with you and she's working at Taco Bell. They're going to take her income as well. So they add all that in together. They take your Social Security, your retirements, your 401k, spouse's incomes, even your gambling winnings. That's very, very important here in the state of Nevada. If you go out and you pull that handle on that slot machine and you win over $1,200 and you have to claim that on your taxes, guess what? Now you have to claim it to the Department of Veterans Affairs as well. If you neglect to do so, that is going to cause an overpayment. It may not show up for 2 or 3 years until they do a Social Security check on you and match it, and then one day they're just going to stop your check and wonder why you didn't get your VA check that month. Well, it's because they did a Social Security check and found out you didn't report your taxes in 2007 properly because you didn't report your gambling winnings. They're also going to garnish your Social Security until it's all paid up. So probably for about 3 or 4 months or longer, depending on how much overpayment it is, you're going to get zero. And if you're on this non-service connected pension, you probably don't have a lot of money to begin with. So you need every penny you can get. So it's very important that you report every piece of income that comes in when it comes in. The monthly payments are made to bring a veteran's total annual income to an established support level. Right now, the eligibility is that the veteran served during a period of war, that they are age 65 or older, or that they are permanently and totally disabled. The veteran's income right now, if they are a single veteran, is $11,830 per year, and that breaks down to about $985 per month. So if you're making more than that through Social Security or other means, other retirements, you are not going to be qualified for this program because the income disqualifies you. And then it shows the rates if you have one dependent, if you're married, or you have a child, it goes up. And then the additional income, it goes up for aid and attendance and housebound. So it can go up as high as $23,396. So there are additional monies out there. Now here's a little trick to this. If you pay any medical out of your pocket, you can write that off. And that money will be deducted, not dollar for dollar, but at a small percentage away from your income that you bring in. So if you're very close to this $11,830 for the single veteran, and you had to pay $4,000 in medical expenses over the past year, then they will take that into consideration and deduct that, and now you may be eligible for $100 a month through this program. So it can be done. There's a little tricks to the trade, but if you are on very close to that, we need to sit down and talk. The dependents and survivors. I will tell you right now, there are not many benefits for dependents and survivors. The way the VA tends to look at things right now is that the veteran is the one who served and put their life on the line, so that the veteran is the one that gets the benefits. However, they do have some things in place, and one of them is bereavement counseling. If your loved one passes away, at any VA center, they can do bereavement counseling for the family. There is a VA death pension. Again, death pension, you're dealing dollar for dollar, money. VA provides pension to low-income surviving spouses and unremarried children of deceased veterans with wartime service. Look at that money, $7,933 per year. It's about $730 a month. So if you're a surviving spouse and your income is over $730 a month, you're not going to qualify for this program. Generally, from what I've seen, what happens is the surviving spouse will get the husband's or the wife's Social Security, and that'll usually bump them over. Or if they have their own job or their own Social Security, that'll put them over the top. I do have several cases in Pahrump who do survive on $7,933 per year on this program. I don't know how they do it, but they manage to do it. The eligibility for this program is the veteran did not have a dishonorable discharge. The veteran served 90 days of active duty with 1 day during a period of war. The dependent is a surviving spouse, and they are not remarried, or if they do get remarried, they are over the age of 57. Or if it's a minor child, they can apply as well, or they're 18 to 23 in college, they can also apply. If you do not meet that requirement, if you're over 23 and you're a dependent, you do not qualify. And it's all countable income, just like we talked about before. Social Security, gambling winnings, 401ks, any retirements, all of that good stuff. Burial and memorial benefits. Here we go. We're talking about the discharge again. Anybody under conditions other than dishonorable can be buried at a VA cemetery. The closest state cemetery that we have is in Boulder City. They also have one up in Fernley for those folks up in Tonopah. That is a state-run facility as well, and you can be buried there for free. The veteran is buried free. Here in the state of Nevada, the spouse can be buried there with you for additional $450. If anybody's done any research on a plot, it is very expensive just to buy a plot. It can cost anywhere from $6,000 to $8,000 just for the plot itself, not costing the cremation or the casket or any of the other expenses involved into it. So $450 for a plot is very inexpensive. The spouse, if they happen to predecease the veteran, they can be buried at the cemetery before the veteran. And it's on a first-come, first-served basis. So what they do is you can turn in your application to Boulder City to certify that you are a veteran and that you and your wife would like to be buried there. They will go ahead and certify that you are a veteran. And when your time does come, you just tell your loved ones you want to be buried at Boulder City or up in Fernley, and they will send you down there. And they don't assign you a plot. You're in J Section 8. They don't give you a plot. It's first come, first serve. If you're in the cremations, they give you the next available niche. So that's how they kind of do that. Headstones and markers. There's three basic things that you get for the burial benefits. You get the hole in the ground, not to be too graphic, but you get the hole in the ground, you get the headstone and the marker, and you get the burial flag. Those are the three basic eligibility programs that you get through burial and memorial benefits. The headstone, you can get flat bronze markers in granite or marble. The headstones must be inscribed with the name of the deceased, branch of service, year of birth, and death. They can also be put additional wording on there, like World War II veteran, Purple Heart, different other symbols on there as well, religious beliefs as well. The burial flag is a simple form to be filled out. And the qualifications, they say that anybody who served after January 31st, 1955, which is the end of the Korean conflict, is eligible. I have never seen anybody that has been turned away for a burial flag. Never. Everybody that I've turned in for a burial flag has gotten a burial flag. I don't know why they put that rule in there or how it got in there, but that's the way the VA law states right now today. You can request military funeral honors if you are retired, or even if you're not retired, you can request through the Nellis Color Guard down here at Nellis Air Force Base, and they can send up a unit and to play taps and fold the colors and present you with the flag. And that's all dependent on if they have a unit available to come out and do the service. Reimbursement of burial expenses. This is very key here. VA will pay up to $2,000 right now if the veteran's death is service-connected. Let's recover what service-connected is. Service-connected is that asthma condition that the VA came back and said, yes, it was aggravated during military service. They gave you that 0%. It is service-connected, and you ended up dying from that asthma condition. It's listed on the death certificate as dying from COPD or an asthma condition. Now it is a service-connected death. The VA will pay up to $2,000 for the burial allowance. If it is not a service-connected death, the VA will pay up to, right now today, $300. In 2 weeks from now, on October 1st, they'll pay up to $700. So if somebody's loved one just passed away, it might be in your best interest to hold off 2 weeks to file that paperwork to get an extra $400 back. That's if you can afford to. There is no time limit for filing for service-connected deaths. If it is a non-service-connected death, you have 2 years to file the claim. If you don't file the claim within 2 years of the death of the veteran, you miss out on that benefit. So it's crucial that you get that paperwork in a timely manner and know what the criteria is on this. The VA will pay a plot allowance, so if you want to be buried in a private cemetery and you don't want to be buried in Boulder City or up in Fernley in the VA cemetery, they will pay up to $300 for that plot allowance. So if you go out and pay $5,000 or $6,000 for that plot allowance, or you already prepaid for one, they will pay up to $300 today, and on October 1st they'll pay up to $700 in reimbursement for that burial plot. In order to get any of this money back, you have to show that the bills have been paid in full, and once the bills are paid in full, you bring them to my office, we fill out the appropriate paperwork and get them to the Department of Veterans Affairs. Turnaround time on this is fairly quick, and it's one of the quickest processes in the VA. We're talking 60, 90 days. So that's very, very quick through the Department of Veterans Affairs. That's if everything's in order. Things we can do that are not monetary in value but are very nice to recognize the veteran is what we call a Presidential Memorial Certificate. This certificate is issued by the VA, which recognizes the veterans for their honorable service. Here is a copy of what one looks like, and it is auto-signed by the current President of the United States. And you can request that if the veteran has passed away. I've done it for both of my grandfathers who have passed away. I've done it for the past 3 presidents. So you can get one each new president that comes into office. You just need to fill out the form and submit it. So it's a real nice, classy way to frame up a picture of them, put it in, and honor their service. You can also, we have the Pahrump Veterans Memorial Wall here in town that we've started building. We can actually get a plaque and put it on the Veterans Wall here in Pahrump. I don't think there's anything up in Tonopah that has been started yet of that nature. But here in town, we can actually do that, and on Veterans Day or when you're just missing your loved one, you can go down there and pay your respect. This is kind of my halfway point right now, so I've just kind of taken a break so I can take a drink of water and see if I have any quick questions. Cruise on. If everybody can bring their questions to the microphone, that way I'm sure everybody has the same question. I'm getting the same questions over and over, and I'm recording this on the PowerPoint. And the reason I'm doing this class is because everybody can be informed. And if one person has a question, there's probably 8 or 10 people in this audience that has the same question. So don't be shy. I'm here to help.
There we go. I would like to be buried in California in Riverside. Can I get a transportation there after I'm gone?
The transportation would be your cost. Would be the next of kin, whoever's transporting you down there, and that would fall under if it was service-connected death, would fall under that $2,000 or the $700 reimbursement.
Okay.
So whoever is paying that cost of transporting you down there, after those bills are paid, they would bring that back into my office and show that the bills have been paid. And then if it was service-connected, we would apply for the $2,000. If it was not service-connected, we would apply for the $700 reimbursement back.
So I would get $700 to transport me down there.
Personally, you wouldn't, because you were being buried. But whoever, but whoever actually paid the bill, yes, they would actually get the reimbursement back. Yes.
Well, my family lives. Am I still going out? Yeah. My family lives in California.
That's a very good point.
I would rather be buried in California, so if they did want to visit me, they'd have to go to Boulder City.
Thank you for your question. That is a very good question. You can be buried in any veteran cemetery in the United States, except for Arlington. There are very high restrictions on Arlington, unless you have the Medal of Honor citation or are personally invited to Arlington Cemetery. You can pretty much be buried at any VA cemetery. The only other restriction is that you actually have to get the paperwork for that particular cemetery. I only have the paperwork for the Nevada one here in Boulder City and up in Fernley, because I only deal with them directly. I could probably look it up on the internet and get that information and make some phone calls and get you that form. So that is a very good question. Thank you for bringing that to my attention.
Yes, my question, Ken, is that as far as cremation for a veteran, just no service-related injuries or anything, would that fall under that category of the up to the $700 reimbursement?
That is correct. Right now it's $300 today, and in 2 weeks from now, on October 1st, then it would go up to $700 for reimbursement.
So we just contact your office at
That
the
is
time
correct.
of death, or we just go through the procedure of, through the...
You get all the paperwork in order. You get the DD-214, you get a copy of the death certificate, and you get a copy of all the bills that have been paid. Once you get all those in order, then you make an appointment with my office, and I'd be more than happy to set up the appointment and walk you through step by step that.
Would you need to go through the procedure of through a funeral home once the death occurred?
That's the normal process, as the veteran or the family goes through a funeral home. And the funeral homes here in town are very good about helping out with supplying with the burial flag and getting set up with some of those benefits.
Okay. My next question is, as far as the income threshold for non-related injuries, just to have the VA benefits in case of illness or something, or at the time of death. I have a benchmark here that I received way back a couple years ago. Veterans with no dependents, with one dependent. Has that changed?
You're talking VA healthcare, correct?
Yes.
I'm going to talk about that. I know you're leaving, so I'm going to answer your question. That's my next point, is to talk about VA healthcare. But to answer your question quickly, right now for a single veteran, it's right about $38,000 off the top of my head, without looking at the actual paperwork.
Okay.
And for a married couple, it's right about the $40,000 to $44,000.
You're right.
Without
That's
looking,
still the same.
without
Yes.
looking, it's probably right about the same.
Each year when we reapply for the health benefits, we just submit our
Your tax forms.
tax
That's
forms.
correct.
Okay. Now, this last year, you're supposed to spend it by April 15th, I guess it is. I forget the date. And we've heard nothing whatsoever whether we're eligible or not. Is that because of backlog, do you think? Or do we just contact the VA office here to see?
Yes,
like
you can contact the VA office right across the street. Usually within 2 days of turning in the paperwork, they notify you. Well, they won't notify you, but you can ask them and see if your
still eligible?
criteria has changed.
Okay. All right. Thank
Yeah,
you.
You bet. Go ahead up in Tonopah, please.
Hi. Can you hear me?
I can't hear you. Try to turn on the mic.
Can you hear me?
There's a button next to there. Nope.
I am hitting the button.
Nope. Got nothing. Hey, Dennis, can you help? Because you had it working earlier.
Testing, 1, 2, 3.
Oh, I can't hear you.
Testing, 1, 2, 3. Testing, 1, 2, 3. It was working before.
I don't know if somebody can grab somebody from the Tonopah Justice Court. Maybe they can show you how to work the microphone there. In the meantime, I'm going to grab this question down here in Pahrump.
It was working before.
Go ahead, sir. Hi. Oh, Dennis, we can hear you now. I don't know what happened.
I don't know.
Speaker's working now. I can hear you.
When you say next of kin, can that be stepchildren?
Absolutely. Anybody, it can even be a church, anybody who pays for the bills for the funeral or burial expenses, they are the ones who actually have to fill out the form and get reimbursed. They're the only ones who can get reimbursed for that payment, are the ones who actually wrote the check and the payment for the burial expenses. That was your question, correct?
Yep, thank you.
Okay.
We've had 2 denials, and we have a new one. Well, it's been 3 years, and we claimed. But he was not in wartime. He was the one day in wartime. But we have a new claim because of the fact that he was released from El Toro, which was the Agent Orange. And so he's been to an Agent Orange doctor, and they've claimed, they said he was considered service-connected now. So next month will be 3 years, and he still hasn't received a notification of the claim or anything.
Okay, I'm going to rephrase your question for the audience here, and Tony Paul, in case I didn't hear you. You were denied twice. The veteran was denied twice. You appealed the decision, and it was granted. Correct? Am I correct? We went ahead and reopened the claim, and it was.
No, you said that we had no chance because he was not in wartime.
Okay.
Right. So in the meantime, we went to the blind rehab, and they did a new claim there because of the ISDB-2 protein. He was released from El Toro, which was contaminated with H1.
Okay.
And every condition he has is related to this Agent Orange.
Okay, so.
And so we were wondering, next month will be 3 years, and we have not even heard an answer from VA. And wonder if I'm disqualified from being.
Let me ask a couple questions to clarify here. Your power of attorney is in Las Vegas with the blind veterans, correct?
Arizona.
Arizona. Okay. I don't believe I am accredited with the Blind Veterans Association. I'll check on that. If I am, I can call and check for you on the status of the claim. If I am not, I would have to refer you back to your representative that you've been working with. Normally, I don't step on toes when somebody's working on your claim. It's kind of a taboo thing to do, is to hop in on their claim. And this is what happens, folks, is if you're working with a client, if you're working with me as your representative, and you go and see somebody else in town and decide to switch power of attorney in the middle of your representation, if they're ready to rate your claim, what happens is they take your file out of the ready to be rated claim because you just switched power of attorneys, and they put it at the very bottom of the stack. So, and then it takes another 6 months, 8 months, however long it takes to get back up to the top of the pile in order to rate the claim. So it can be very detrimental to your claim. So if you have a claim that is currently pending and has been pending for a while, and it's at the 3-year mark, it might be in your best interest to see it through with whoever helped you file that claim. I can maybe do some investigation work and try to help you find out what's going on with it. You have my phone number. I would definitely at least make an appointment with me, and we can investigate further one-on-one and on what we can actually do.
What I'd like to know is she takes care of me, and we're not married. So shouldn't she be able to get some kind of compensation for that?
Well, the veteran would be eligible for aid in attendance or housebound if you met the criteria, if you were granted for a service connection or non-service connected pension, and you applied for those programs and met the qualifications. And the VA could grant that based on that. And then what you did with that, they do the program in 2 different ways. They can either have a program come in, like home health care, and take care of you, or they could pay you a monetary amount and have you pay somebody to take care of your assisted living needs.
I have one more question. Is there back pay if we were ever...
Yes, there is back pay available if this claim has been continuously sought from the time that you've originally filed the claim all the way through. If it has not been appealed and the decision was final, then it starts from the day that you reopen the claim with the new power of attorney. And I'm going to touch more on that at a later, in 30 or 40 minutes. Thank you. All right, well, let's move on, and we're going to touch on the health care benefits now. Oh, we got one more question here. Push the green button. Push the push button. Right? I can't hear you. I can't hear you.
My question is about oxygen. At one time, the VA was paying for Mr. Jules' oxygen at home. Then all of a sudden, when we change carriers on our insurance, we have to start paying a portion of that payment to the company that is furnishing the oxygen. The VA is not picking it up. Is there any reason for this?
That sounds like a billing problem in the Department of Veterans Affairs. That is something that I don't handle. I can definitely give you the phone number and point you in the right direction, but I do not handle anything that has to do with health care or the billing department. I can merely pass on to the people who work in those departments. Like I said, I am not a VA employee, and I don't work in that in any of those departments. My job is to help fill out for the benefits and guide you and to assist you to get to the right departments. So I can definitely help facilitate that. I'll get you those numbers.
I thought maybe it was because we have to wait and see if the claim goes through to see if he was actually qualified.
Sounds to me like they found out that you had a secondary insurance, so they started billing the secondary insurance first, and then they started billing you for the copay from the secondary insurance, and the VA didn't pick it up.
Okay, thank you.
That's what it initially sounds like. All right, if you can hold your questions, I'm going to go on with the VA benefits portion of this, and then...
Been 41 years.
I can't hear you. You got to get to the mic.
Take a hold, huh? Can you hear that?
No, you got to push the green button. Push. There you go.
Is that the right button?
Yep.
Okay, it's been 41 years, and I just filed. And I was told to make an appointment with you in your office.
Okay.
And then you guys called me and told me that you were having a meeting down here today. And the office over there told me to come over here and tell you that I need to make an appointment because you just told me that this place was open for today.
The reason I had this meeting today and for everybody in it is, as I stated in the very beginning of this PowerPoint presentation, is to inform you of the benefits that are out there, what you need to bring in for your benefits, what you need to bring in for paperwork-wise, so when you do come in for your appointment, you have all the documentation so we can file. If I sat down with each individual in here, I'd have to spend 2 hours talking to each person about the same 2 hours and the same benefits. And by grouping this together, I'm talking to 75 people right now and cutting down 150 hours of work for myself. That's why I'm having everybody come in all together and get all their paperwork in order, crush the rumor mill about what VA benefits are and what they are not, what is eligibility and what is not eligibility, and what programs are out there. So when you do come in my office, those questions are answered. You come into my office prepared, and we can file the paperwork.
Okay.
That's why I called you down here today.
Okay, because the guy across the street got all the paperwork for me. And
Guy across the street.
at the veterans place
Okay.
across the street, he got all the paperwork for me, and it's in the mail. And he told me to make an appointment with you, and I called your office, and your office said they were having a meeting down here.
That is correct. That's
I don't have the paperwork yet.
and you will not get a follow-up appointment until you have all the documentation.
Okay, that's my DD-214 and the stack of
Right,
goodies that go
and
with it.
I'll get into that just here in the next portion of the presentation.
Okay, well, I know that I got to wait for that, but I was finding out, do I just call your office and make an appointment because I'm from out of town?
After you have all the documentation, yes.
Okay, that's all I need.
Yes, sir.
Sorry I'm late and interrupting.
Moving right along, the health care benefits is very easy to apply. To apply, you need to fill out what they call a 1010EZ form. 1010EZ form is a 3-page packet. It asks for your basic information, your name, date of birth, social security number, where you place where you're living now, And then it has, on the second and third page, a lot of financial information. If you check, there's a box on there that says, do not wish to provide financial information. If you check that box, it's an automatic denial for VA healthcare benefits. You have to provide the VA with your healthcare or with your financial information. I'm going to explain that in just a minute here. The following three categories are not required to enroll into VA healthcare, but here at the VA Healthcare in Pahrump, they pretty much require everybody to fill out the 1010 EZ. The reason for that is because you would think that all VA healthcare are networked together. They are not. So when you go to Las Vegas is not networked with San Diego. So that San Diego cannot have access to your records when you go down there unless Las Vegas sends them your records. It takes a little bit of a process, and you would think that they're all networked, but they're not. Pahrump being a rural community here, they are not networked to Las Vegas, and they are not networked to any of the other places, San Diego or even East Coast, New York, any of those offices as well. So they make you fill out the 1010 EZ so they can get your information in the system and verify that you are an actual veteran and qualified. And once they get you in the system, even if you're enrolled into another place and just moved here from another town, now they can pull your information from the other location that you were just at and put it in the system. Veterans with a service-connected disability of 50% or higher are not required. Veterans who are determined that their injury was incurred or aggravated in the line of duty, who are seeking care for their disability, but which the VA has not yet rated within the first 12 months of discharge, you do not have to require to enroll. And veterans seeking care for a service-connected disability only are not required to enroll. However, like I said, there are exceptions to that rule. The exception here in Pahrump is everybody must fill out a 1010 EZ. Iraq and Afghanistan combat theater veterans, automatic 5 years of free health care provided after they get discharged. So if you know somebody who's getting discharged or just recently been discharged, tell them to go sign up at the VA. They get 5 years of free health care service. And as you know, when you first get out of service, you probably don't have health care, or you're trying to get a new job and they don't give health care right away anymore. Get them enrolled in the health care system. There are different priority groups in the VA health care system, and the reason the VA came up with these priority groups is that the VA was being overrun with veterans. So they had to assign these priority groups to balance the demand with the resources that they have available. So priority group number 1 is 100% service-connected veterans. They're supposed to be seen first. Second priority group is 90 to 50% service-connected, and it kind of goes down the list. As you hit priority group 5, those are Vietnam-era veterans or exposed to Agent Orange or Purple Heart veterans. And then as you go further down the list, then you get to the non-service-connected pension, and then category 7 and 8 are based on income levels. And if you get into the lower categories in 8A, B, C, D, and G and E, then you're talking about income. They do qualify you because you're honorably discharged, but your income is too high, just like that lady had asked about the income standards. Here in town, for a single veteran, I believe it's right about $38,000 for the year for income standards, and for a married couple, I believe it's right around $40,000 to $44,000 per year without actually having the documentation in front of me. So if your income is higher than that, and you're not service-connected, and you're getting newly enrolled in VA healthcare, there's a chance they could come back and say, yes, you are eligible, but we're putting you in priority group 8G, which means that we are not going to allow you into the system at this time. The VA will notify any member affected by changes in the policy. So if they come out with any new policies, and if you're on the 8G category and they open it up to you because they've changed the income standards, now they're going to send you a letter and say, hey, Mr. 8G category, you now are qualified. You might want to go down and check it out. Or if they reduce those, then they're also going to send you a letter and say, we just reduced the income standards, now you do not qualify anymore. These are covered to all veterans who are enrolled in the VA healthcare system. Immunizations, physical exams including eyes and ears, healthcare assessments, screening tests, and health education programs. These are all covered as preventive care services. Another thing I want to mention is that if you're not getting services, if you have VA health care and you don't use it within 2 years, they automatically kick you out of the VA system. So if you have other health care insurance and you're using that over VA, go get your physical once a year, get checked up, keeps you enrolled in the system, keeps you going. If that other insurance goes away and you no longer have it, you're still enrolled in the VA health care system because you're grandfathered in right now. Because if they kick you out of the system, you may not qualify due to the income or the changes in law that they make. So make sure you go at least get a minimal of a physical each and every year if you're not using VA. The outpatient things that the VA provides is emergency outpatient care in a VA facility, medical, surgical, including reconstructive plastic surgery as a result of a disease or trauma, chiropractic care, bereavement counseling, mental health, and substance abuse. These are all provided to enrolled veterans. Inpatient hospital, they will take care of emergency outpatient care in a VA facility, medical, surgical, mental health, and substance abuse. You're going to see a lot of the same things on these lists. So, limited benefits. Each one of the things that I'm going to cover on this list have different qualifications. They do cover these, but each one has a certain different qualification. Ambulance services, dental care, durable medical equipment, home health care, homeless programs, maternity services, non-VA health care services, orthopedic, prosthetic, and rehab devices, rehab services, readjustment counseling, sexual trauma counseling. Eyeglasses. You must be service connected at 10% or more. If you're service connected at 10%, you get your eyeglasses every year, free of charge. You go into your VA provider and ask them, I want to get my eyes checked to get a new prescription. They provide them to you for free. Anything through the VA, you have to go through your health care provider and ask them for the services. They put in a request, a referral, and then they put it in the computer and send the referral out. So if you need glasses, you need dental work, you want an x-ray on your knee, whatever the case may be, you have to go and see your primary doctor through the VA and ask them for that test. If you don't go through that proper protocol, you're not going to get it. That's one of the biggest things that come into my office. People come in and complain about the VA healthcare system because they're not maneuvering the system the right way. You also get hearing aids if you're service connected at 10% or more. So if you need hearing aids and you're service connected at 10%, and even if it's not for your ears, you get eyes and ears at 10% service connected. So if you have that asthma condition or that broken arm that they service connected 10%, you get eyes and ears for the rest of your life. Hearing aids they will provide every 5 years and give you new hearing aids. They will provide you with batteries for your hearing aids throughout the life of the hearing aid. They will take the hearing aids in and clean them and readjust them if your hearing deteriorates. To qualify for the hearing aids and eyeglasses, you must have a VA service-connected disability of 10% or more. An individual may also qualify if he or she is a former prisoner of war, Purple Heart recipient, and this requires benefit of a treatment of a service-connected disability for your eyes or your ears. So if you have a 0% on your eyes or your ears, this is also going to be provided to you free of charge. And also down there on the very bottom it says pension-based with regular aid and attendance or being permanently housebound. So there's also little caveats added on to that as well. Exclusions. These are things that the VA healthcare does not cover. Abortions and abortion counseling. Cosmetic surgery except where VA determines medically necessary. So if you want to have surgery and you want to go look like a famous person, they're not going to cover that. But if you need it because you have a disease or trauma that happened to you because something blew up and you have scarring, or they will cover that to reconstruct that part of your face or your body. Gender alteration. Health club spa membership, even for rehabilitation, they will not cover. in vitro fertilization, drugs and medications not approved by the FDA, services not ordered and provided by licensed and accredited professional staff. So if you go down to Billy Joe Bob Smith down the street who cracks backs real good, but he's not accredited or licensed, he's not going to get paid by the VA, and they're not going to cover that services. So you make sure when you go to see your chiropractor that they do have the proper authorization and that the VA sets it up through the VA. Special private duty nursing, again, these are all not covered by the Department of Veterans Affairs. Non-emergency health care, this is probably, the next two slides are probably the most important slides for VA health care. If you don't pay any attention to anything else for VA health care, pay attention to these next two slides. Veterans are eligible for emergency at non-VA facilities only if, and this is only, if the VA determines that the health care facilities were not feasibly available. We live in a very rural community, especially up in Tonopah. And here, we live in a rural community as well. Our Pahrump Clinic here closes at 4 o'clock. If you decide to have a heart attack at 5 o'clock at night when our hospital or VA clinic is closed, you obviously need to call an ambulance or go to the nearest clinic and get treatment right away. For those up in Tonopah, you need to get treatment right at the regional clinic up there as well. And this is in the parentheses here, the delay of medical attention would have endangered the veteran's life or health. That is the key, and that's what the doctors have to say and put in writing when you go to the emergency room. If you go in there because you feel like you're having a heart attack, and they go in and find out that it's just a big gas bubble, and the doctor writes, gas bubble, no big deal, they're not going to cover it. But if they write down, veteran came in here, felt that he was having a legitimate heart attack, and it was for emergency purposes, now they're going to cover it because you thought your life was in danger. Very key on the wording. Even if they found out it was a gas bubble, they're still going to cover it because they thought your life was in danger. The veteran is liable for the cost of the services if they do not meet the criteria above. That's why it's important to get that wording by the doctors. The care for the service is service connected, then they will cover it. If enrolled, the veteran has been provided care by a physician within the past 24 months. So like I said, if you have other health care insurance, go to the VA once a year, get an annual physical. I'll keep you enrolled in there, and you don't have to worry about that 24-month period. You get an annual physical anyway, get a checkup, see, make sure you're doing okay, and it doesn't cost you anything, keeps you in the system, and you're good to go. Very, very important. This is that second slide that I said was important. If you don't pay any attention to anything else, this is the second slide you need to pay attention to. If non-VA emergency health care is received, you must notify the nearest VA health care facility within 72 hours of hospitalization. If you don't notify the VA hotline, which is on the back of your VA ID card, there's an 800 number, or if you do not call the clinic, or your loved ones call the clinic within 72 hours of being hospitalized, you are now fully responsible for that bill. 100%. There's nothing nobody can do about it. VA payment is limited up to the point that the veteran's condition is stable for transportation to a VA facility. The job when you go in of those physicians are to stabilize you. They find out, okay, he has a heart attack. Let's stabilize this veteran. Get him stable. Now what they have to do is they notify, okay, this is a veteran. We have to get him to the VA facility if one is available. Closest one to us and to Tonopah is either Reno or to Las Vegas. So they either ambulance or flight life you down to Las Vegas if they have a bed available. If they don't, they're going to continue treating you where you're at. Now, if you deny going down to Nellis or up to Reno, they're going to start denying your benefits at that point in time. That's when you become responsible for paying that bill. There are travel benefits available for veterans who qualify, and they're one of these categories. If the veteran has a service-connected rating of 30% or more, each time you go to a VA facility outside your area code, you're eligible for VA travel pay. I don't have it listed in this slide yet, but they just changed the way they do VA travel. They used to pay you cash on the spot when you went in for your VA travel pay. They don't do that anymore. They do it all electronically, and they do it into your bank account. You have to fill out the form, and when you go and check in for your appointment, if you meet one of these categories, you tell them, I want to fill out my travel form. As soon as you check in, they'll fill out your travel form. You sign it. Within 5 to 7 business days, that money will show up into your bank account. If you're traveling for a service-connected condition, if you receive a VA pension, if you are traveling for a scheduled compensation exam, and if your income does not exceed the maximum annual VA pension rate, and the last one is if the medical condition requires an ambulance or a specially equipped van that the individual is unable to defray the costs, and the travel is pre-authorized. So if you meet one of those conditions, the VA will pay you travel pay to and from your doctor's appointment. Here's a little kicker. Right now, I think the rate is missed on here. The rate is 41 cents a mile. I think it's actually gone up. I think it's right around 55 cents a mile now. This is for round trip mile or an unscheduled visits. They will only pay you one way. So if you go down to the VA and don't have an appointment, they will pay you one-way trip. There is a deductible for your first 3 visits of the month. This is the way the VA kind of takes back a little bit from you. It used to be $3 for each one-way trip or $6 for one round-trip visit. Right now it's gone up to, I believe, $7.77 per month or per visit, for a maximum of just a little bit over $22 per month. So when you go down to Las Vegas or you go up to Reno for your appointment, the first 3 visits, they're going to take this deductible out. After your first 3 visits, they stop taking the deductible out and you get your full amount. Dental benefits. I get a ton of questions on dental. Do I qualify? What are the qualifications? Very few and far in between qualify for dental benefits. Dental benefits I'm going to keep real mean and real nasty and real dirty. Unless you are 100% service connected, you will probably not qualify for dental benefits. However, I'm going to go through the eligibility because there are some other things that do qualify in here. The eligibility is for veterans service connected for a dental condition, which is dental trauma. So if you have dental trauma and the VA acknowledges it and service connects it, now they will service connect it. So if they say that 2 front teeth are service connected, the VA are going to service connect and treat those 2 front teeth. If you have wisdom teeth or a cavity in the back, they are not going to cover that. It's those 2 front teeth they will cover. If you are a former prisoner of war, now they will cover all of your teeth. Veterans with service-connected, non-compensable dental conditions as a result of combat wounds or severe injuries. So if you get hit with a rifle butt in the mouth, again, and they crack your 2 front teeth, those are the only 2 teeth that they are going to cover. Veterans with a non-service-connected dental condition determined by VA to be aggravated by a service-connected medical condition. So if you have a problem and it caused your teeth to fall out or to deteriorate, then they will cover those teeth that have deteriorated and have fallen out. But it is limited to those teeth that had the problem. Very few and far in between, very tricky. Like I said, I'm going to be very mean and nasty in this. Veterans with 100% service connection or who are rated unemployable are usually the ones who get the benefit of the dental care. Veterans in a VOC rehab program are eligible for dental care, and that is usually emergency care. If you have a cavity and a root canal and it just has to be done, they will take care of that, and that is all they will take care of. Certain enrolled homeless veterans are eligible. Veterans with non-service connected dental conditions that receive dental treatment while an inpatient at a VA facility, which is very few and far in between. Veterans requiring treatment for dental conditions clinically determined to be complicating by a medical condition currently under treatment, few and far in between. And recently discharged veterans who just got out within 90 days of active duty can get their dental treatment done. And that's the other one that I see most often, is the kids coming back today say, I didn't get my dental when I got out. So we can get them their dental if they come and see me within 90 days of being discharged. Education benefits. Use them or lose them. Most folks in this room and probably up in Tonopah are under the old Montgomery GI Bill or some of the older programs. The older programs for the Montgomery GI Bill is you have 10 years to use it or you lose it. You have 10 years to completely use your GI Bill. You can't use it on the 9th year, 9th month, and can use your whole GI Bill. If you use it start using it 9 years and 9 months, you get 3 months of GI Bill benefits. If it's past 10 years since you're discharged, say goodbye to your GI benefits. The post 9/11 GI benefits I don't have a slide on, but if for the new kids coming out today have post 9/11 GI Bill, anybody with service after 9/11, now they have 15 years to use their GI Bill. They get more money, they get a housing stipend, and they can actually transfer that to their family members. So if they're not going to use it, they can actually transfer it to their wife or to their children. So they're making leaps and bounds in the education department. Home loan guarantees. You can use your home loan for a lot of different things. You can use it to buy or build a home, buy a residential condo, repair, alter, or improve a home, refinance an existing home loan, buy a manufactured home with or without a lot, buy and improve a manufactured home lot, install solar heating and cooling systems or other weatherization improvements, buy a home and install energy efficient improvements. The eligibility requirements are this. In the addition of the periods of eligibility, so you have to meet the eligibility of all that other stuff that we talked about before, and the conditions of service requirements, the applicants must have a good credit rating, and that's how they determine what your interest rate is going to be. Sufficient income, that's how they're going to determine how much they're going to loan you, and a valid certificate of eligibility, which we simply fill out the paperwork and turn in. It takes about 30 days to get a certificate of eligibility back. And you have to agree to live in the property for 2 years. If you do that, you're going to get the certificate of eligibility, and you go take it to the lender of your choice. That's when I walk away from it. You take it to the lender, and they do their wheeling and dealing. You pick the house, you pick the rate, and do all that other fancy stuff and close the deal. Now the house is yours at whatever the bank says the interest rate is and whatever they say they're going to loan you. But they have to pass all those different things. Presumptive conditions. Presumptive conditions I'm probably going to talk about here for a couple of minutes, and they're very hot topics. There are a lot of presumptive conditions. I'm going to use just a couple of presumptive conditions here. Prisoners of war, veterans exposed to Agent Orange, radiation, and Gulf War veterans. Those are just going to be a couple of them that we're going to talk about today. Agent Orange veterans. There was a question up here earlier for veterans who were exposed to Agent Orange. The most common way that veterans are exposed to Agent Orange is that they set foot in the country of Vietnam, or they were in the brown waters of Vietnam, which is the inlet waterways of Vietnam. And if you can prove that, then it's anything that's listed on the sheet is a presumptive condition of Agent Orange exposure. What does a presumptive mean? It means that they presume that you were exposed to Agent Orange, and that if you come down with one of these now 13 or 14 different conditions, that they're going to automatically grant the benefit. The benefit is going to be granted based on how severe the disability is. Yes, we'll bring the slide back up. As the lady brought up the question before, there are other ways to come in contact with Agent Orange. 90% of the time, or actually probably about 98% of the time, it's by being in country of Vietnam. Vietnam was stored stateside, it was on ships, it was on planes. You have to be able to prove that you came into contact with Agent Orange, whether stateside, or whether on a ship, or whether on a plane. You have to be able to prove. And this goes with any claim with the VA. This is a court of law, and this is a court. You're going in front of the VA. You have to be able to prove that whatever you're claiming is related back to the military. So you have to be able to prove that he or she was exposed to Agent Orange. If you can prove that he or she was exposed to Agent Orange, now we have something to link off of. Some of the things on this list which we normally see are chloracne, and that has to show up within 1 year of being discharged from active duty. Soft tissue sarcoma, Hodgkin's disease, multiple myeloma, respiratory cancers, non-Hodgkin's lymphoma, prostate cancer, which is a huge one, which we see a lot of, diabetes type 2, peripheral neuropathy, chronic lymphocytic leukemia, ischemic heart disease, Parkinson's disease, and B-cell leukemia, hairy cell B leukemia. The ischemic heart disease, Parkinson's disease, and B-cell leukemia just got passed September of last year. What they did is they retroactive. So if you filed a claim 8, 10, 20 years ago and were denied for ischemic heart disease, Parkinson's disease, or B-cell leukemia, they had to reopen all the files and go back in and reopen them to see if they were wrongly denied. The VA had to pay $66 billion in retroactive payments for those 3 alone. What happened, and a lot of your claims, all of them got stopped. They stopped processing every single claim in the VA until these 3 claims got processed. The VA decided these 3 issues are so important, we're going to pull every single file, and until these are done, we're not going to process another single claim. So what did that do to your claim? Added another 6 to 8 months onto your claim. So now your file is sitting there dormant. So you're asking, why is my claim taking 2, 3 years? This is one of the reasons why. But they just got done clearing up most of these Agent Orange, and now they're starting to work on the terminal illness veterans, the veterans who are homeless, the Iraq, Afghanistan veterans who are coming back, and then they're working on the bottom echelon, which is somebody like me who is a older veteran now. I call myself, because I served 15 years ago, and then the Vietnam, Korea veterans are falling into that bottom echelon of service connection getting rated. For children, a lot of people ask, I pass this down to my children. What does the VA acknowledge as far as disabilities in children? Right now, today, the VA only acknowledges that spina bifida in children has been passed down via Agent Orange. So if your children has spina bifida, we should be filing a claim immediately for that disability. They do not recognize any other disabilities related due to Agent Orange for children. There is an Agent Orange registry. It is important that you get on that Agent Orange registry. And that's why these 3 new conditions got added on. What ends up happening is you get added on to this Agent Orange registry. They do a series of checks. They do blood work, lab work, and test you for all these different disabilities. They come back and say, oh, okay, well, hey, 85% of the veterans on this list were exposed to Agent Orange. Their left ear is falling off. Don't you think we should probably put the left ear on this list? So they do a study and add the left ear on it. That's how these 3 other conditions got added on. Now they go back, so all these people who have their left ear falling off, now get their left ear added on as a service-connected condition. I just threw the left ear out there because they're kind of off the wall, but people would understand where I'm coming from. Asbestos exposure is another one of those presumptive conditions. A lot of Navy veterans were exposed to asbestos. Asbestos, what is asbestos exactly? They're tiny little fibers that are inhaled into the lungs, which cause cancer where the fibers settle. It's usually in the lungs or in the bronchial or gastrointestinal. It's another risk factor for lung cancer. So there's telltale signs of whether smoking caused the COPD or if the asbestos exposure caused the condition that you have today. On x-rays, it looks like there's little tiny, I'm not a doctor by any means, but this is how I had it explained to me. There's little tiny splinters, kind of like you had a splinter in your finger. They settle, the fibers settle in your lungs, and every time you take a breath, it just kind of like when you're rubbing that little splinter in your finger, it just kind of irritates it. And over time, it just starts to deteriorate your lungs or wherever it actually settles. And then you start to develop these problems. If you smoke, it'll increase those risks. But if your lungs come back and they're black, well, that's usually signs of that you were smoking or smoke inhalation, not because of the asbestos. It's a very clear cut. When the doctor, this is what the doctor told me, when you look at the x-rays, whether it's asbestos or whether it's from smoking. In World War II, they were used widely to strengthen cements and plastics for insulation, for fireproofing, aboard ships, boilers, steam pipes, and hot water pipes, and friction products such as brake linings, gaskets, and clutches. And that went on all the way through Vietnam, and when they started pulling those ships into port and cleaning all that stuff off. And I've heard stories where they were people would fall asleep in their rack, and they would wake up and they would be covered in this tiny little dust, and they didn't, because the vent was right above their head. Well, those pipes were all lined in asbestos, and those fibers were coming out those pipes, and they would just settle on top of you, and you would just breathe them in and while you were sleeping. So you were exposed to them the whole entire time you were on ship. So if you were aboard ship, or if you were aboard and the ship, when we can prove that there was asbestos aboard the ship while you were on it, or in any of the places that you were while you were working on the brakes or in the boiler rooms, we can get asbestos as service connection from a presumptive condition. That is exactly like an Agent Orange condition. These are all presumptive conditions. So if you come down with this, it is all presumed that if we can prove that you were aboard the ship and it had asbestos on it, and you have this condition now, it is presumed that you were exposed to the asbestos and the problem is related due to the asbestos. So now they are going to pretty much go ahead and grant it. It's not always a guaranteed grant. It's not a slam dunk. A lot of people use that term. It's a slam dunk. Most of the time they will go ahead and grant the benefit. Veterans exposed to radiation. Veterans exposed to ionizing radiation, which is the atomic blast down there. A lot of times they put people on the ships and line them up on the deck of the ship and said, watch this. Boom! Anybody who was exposed to that was exposed to radiation. Anybody who was around that type of stuff, most of the time it caused all forms of leukemia and a lot of different types of cancers, and they're listed here, everything from thyroid, breast, esophagus, stomach cancers, all the way down. I mean, looks like there's 15 or 20 of them. But if you have a type of cancer or a form of leukemia because you were at Operation Dominic and was exposed to a radiation blast, you need to get that documentation and come and see me. Post-traumatic stress disorder. Hot, big topic. How do we get post-traumatic stress disorder? What is post-traumatic stress disorder? PTSD is a mental disorder that develops as a result of a stressful event. It may develop hours, months, or even years after the stressful event took place. It's usually, in my line of work, I usually see it related due to combat. It's not always related due to combat. It can be from sexual trauma. And that's from somebody being sexually harassed, such as rape, physical assault, domestic battery, robbing, mugging, and even stalking. That can cause and trigger PTSD. If this happened to you while you're on active duty and you have record of it, we can file for PTSD if you have a diagnosis of it. The basic situation for PTSD is any life-threatening situation. And the circumstances can include natural disasters such as fires, floods, earthquakes, car or plane crashes, and it cannot be just limited to one single event. It can be a series of events that happened. So if this event kept happening over and over and over, and it led to your condition that every time you see something or smell something, it leads to this tremendous fear, or anxiety, or panic attack, yeah, you probably have PTSD. The picture of that guy down there in the bottom right-hand corner. You think that guy has PTSD? Sure looks like he's been through a lot from my eyes, and he probably has PTSD. In order to be service-connected for PTSD, you must have medical evidence establishing a clear diagnosis of the condition. You can't just go by your word saying, oh, I have PTSD. You actually have to go and get treated for it. Get a diagnosis of having PTSD, depression, anxiety, whatever the actual diagnosis is. And this is what I tell a lot of people when they come in my office. If you come in my office, tell me, Ken, I have PTSD. We need to file right away. I've had this for 45 years. And this happened because of this, and this. Well, okay, well, if I fill out the paperwork and send it in, and then send you to treatment, the doctor comes back and says, well, you don't have PTSD. What you actually have is anxiety/depression disorder. Well, now we put down the wrong body part, or actually wrong diagnosis. The VA is going to come back and deny the claim because we put down the wrong diagnosis. Another example of that is if you flipped over that Jeep, which we talked about in the beginning, and you said, hey, I flipped that Jeep over in Vietnam and I broke my elbow. Well, I write down broken elbow. And we come back and get your records from service and find out that it was your wrist that you broke. We wrote down the wrong body part. The VA is going to quickly deny that claim. We've just wasted my time, your time, and the VA's time because we put down the wrong body part. It's in your best interest to get all your ducks in a row, get all the paperwork together, and get everything right the first time. Don't let the VA give them a chance to deny you. A lot of people in this industry will sit down with you and start filling out paperwork based on a veteran's word. It's evidence that we have to have. If you don't have evidence, you don't have a claim. You have to be able to prove in a court of law that what you are asking is related due to what military service. And if you can't prove that, you don't have a claim. With PTSD, as that little sticker shows down there, not all wounds are visible. You can't physically tell if somebody has PTSD by looking at them. At least in most cases you can't. So we need credible supporting evidence that the claimed stressful in-service event actually occurred. So if there was combat and you have a CIB, Combat Infantry Badge, on your DD-214, well, that's going to show that you were in combat. If you have a Purple Heart or you have a Medal of Honor, well, that's obviously going to show that you were not handing out candy to, little children out there in Afghanistan. They're going to take that for what it's worth. They just don't hand those out usually for nothing. And then you have to have what they call a nexus statement, which is a link from your military service and the problems that you're having today. And that's usually written up by a doctor saying, yes, the PTSD that the veteran has today is linked directly back due to the combat that the veteran saw and related to the Combat Infantry Badge and the Purple Heart from the shrapnel wounds of the left knee. So it can be related. There's just a little bit more work to tie this in for PTSD. Gulf War veterans, they also have a Gulf War registry out there. They're being very proactive about it. It took years to get an Agent Orange registry going. They already have one for the Gulf War veterans. They have a lot of things added on for the Gulf War veterans, and are acknowledging a lot of different things. Again, they do a complete physical exam with labs. You don't have to be registered in the VA to qualify for the Agent or for the Gulf War registry. Undiagnosed illnesses. Right now, there's a hot topic with the Gulf War vets coming back, with being exposed to the burn pits and all the gases and stuff that were released, and undiagnosed illnesses out there. An undiagnosed illness is basically something that a veteran has multiple conditions of, or that they have a condition that lasts for 6 months or gets worse over a 6-month period, and they can't quite nail down exactly what the diagnosis is. And you can actually get a claim under an undiagnosed illness based under a presumptive on the Gulf War registry. And you have to serve after August 2nd, 1990 in theater and suffer from a qualifying chronic disability. And as I said before, chronic illness may be a medically unexplained chronic multiple symptom illness such as chronic fatigue syndrome, fibromyalgia, or irritable bowel syndrome. So if you have a combination of those two things and they don't quite know what it's coming from, that could qualify as an undiagnosed illness. They are currently coming out with new things every day on the Gulf War veterans, and this list is probably out of date already. Again, the chronic condition is a disability that lasts for 6 months or gets worse over a 6-month period. Here are some of the symptoms of a Gulf War veteran: undiagnosed illness, fatigue, skin disorder, headaches, muscle pain, joint pain, neurological symptoms, neuropsychological symptoms, symptoms involving the respiratory system, sleep disturbances, gastrointestinal symptoms, abnormal weight loss, menstrual disorder, or 2 or more of the combined above issues. And as you can see, that fire burning in the background of that gentleman standing there, he was probably exposed to a lot of toxins and hazards. He may very well come down with some of this later down in the future. Just like it took a lot of the Vietnam era 40 years for him to start showing up with prostate cancer and diabetes. Sometimes it takes a long time for these things to start showing up. Start getting the testing done, start getting this work done. You just never know when it's going to show its ugly head. If we file a claim and the VA decides that they're not going to grant the benefit in your favor, you can appeal the decision. My office can help you appeal that decision. Other people in town that help with VA benefits do not do that. I am the only office in town and up in Tonopah that helps file appeals and take them all the way to the appeals court. I represent the veteran down at the Board of Veterans Appeals in Las Vegas in a video teleconference with the law judge. That's why we have to have the evidence. If we don't have the evidence, I can't take it in front of a law judge. You have 1 year from the denial to file an actual appeal. If we file the appeal in a timely notice, they're going to send you a statement of case. When they send you the statement of case, which is a reason on why they denied you, we have 60 days to turn in an actual Form 9 or an appeal. Once we perfect that, then they will set us up for a date where we go and sit in front of a real live law judge, and I get to play Matlock and explain laws and rules and regulations to them on how this is related to your military service. And then I can bring you in and you can testify to them, and this is where I was, and this is what I did, and this is how this is related to my military service. This should be service connected. So we kind of work hand in hand in order to win this claim. The Board of Veterans Appeals ultimately makes the decision on the appeals on behalf of the Veterans Secretary, the Secretary of Veterans Affairs. And then if that fails and they come back and deny you, that is not the end of it. You can go to the Court of Veterans Appeals for veterans claims. However, if you do decide to go that route, that's when my office backs out and you go find yourself a lawyer and go dig the trenches and start your long-term battle. Because I cannot fight at the Court of Veterans Appeals for veterans claims. I can only take it to the Board of Veterans Appeals. If you do take it to the Court of Veterans Appeals for veterans claims, the lawyer will probably, the top they can get is 20% of your retroactive benefits. So if you do end up going that route or going to get a lawyer to help you with your benefits, they will take 20% of your retroactive benefits. They will not get your monthly stipend after that. So if you're awarded $3,000 a month and you're retroactive 5 years, they get 20% of that retro. But they will not get that $3,000 a month, 20% of that. You are entitled to that $3,000 from that point forward. Here are some cool things that we can do in our office that are not monetary in value, but are really nice things that we can do for you. We can get a copy of your medals and ribbons to discharge veterans, and we can replace them once if they were lost, stolen, or destroyed. The requests for awards that were never earned or never issued. So if they put a Purple Heart on your DD-214 and they never gave it to you because they shipped you out of country so fast, because they shipped you to Germany to get well, you can actually put in and get your Purple Heart awarded to you. The next of kin can actually request a copy of the medals as well. So we do, sometimes when the surviving spouse comes in my office, we do the Presidential Memorial Certificate, we order a copy of the medals and ribbons, and we do a nice shadow box and really memorialize the veteran and their service. A really cool thing to do. We need the same information that is found on the DD-214, so if you get a hold of the DD-214, that's the best case scenario. And this is sent to the branch of the service that you served in, not to the VA. So if you served in the Army, we send this to the Army. And the Army is the one who actually issues the medals and sends them out to you. If you need a copy of your DD-214 or your military personnel file, we can actually obtain that for you in our office. There's actually a video on our website on how to do it on your own if you have internet access as well. I've got the link up here. I've actually got it on the website, and it should also be in the handout packets up in Tonopah and out in the audience out here today. So if you have that, it's all in that on how to get that. Need as much information as you can, the veteran's name, signature of the veteran, or the signature of the next of kin if the veteran is deceased. You need the veteran's service number, social security number, approximate dates of service, as much information as you can give them. I'll show you why. Here's a picture of NPRC in the very top center of your screen. NPRC is a building. That building is approximately a mile long, about a half mile wide, and then you got that extra side building on there. On the bottom left-hand corner of the screen is a picture of what the building looks like inside. As you can see, it's floor to ceiling with boxes. Those ceilings are about 15 to 20 foot ceilings in there. So imagine having a 5 or 6 story building and having millions upon millions of files in there, and you put in a request for records. They need to know exact information so they know exactly what golf cart to get in and what section to drive down into and what box to pull out to find your files. On July 12, 1973, there was a fire, and there's a picture of it in the bottom right-hand screen, and it destroyed about 16 to 18 million files. Most of them were Army and Air Force records, and they know exact dates and names that were burned. From November Army records, November 1st, 1912 to January 1st, 1960. And Air Force, September 25th, 1947 to January 1st, 1964, with names from after James E. Hubbard. So they very well could be. And after you get out of service, then your records go to this warehouse. Yeah. The question was, his records were burned up because he enlisted in '63 for those in Tonopah. The answer to that question is no. When the date of your discharge is the date that your records are supposed to go to NPRC, and they're supposed to be stored at that warehouse at that point in time. So if your records were stored in that warehouse on that date in 1973, there's a good possibility if you served in the Army or the Air Force that your records could possibly be burned. However, I do not discourage you from asking for your records. That's correct. He retired from '79, and that's when his records would have gone into service. So always request your records, And if they cannot find him, they'll send you a letter and certifying that you did serve honorably and that your files were burned in the records. Or let me try that again. My dyslexia is kicking in. The fire burned your files. Thank you. And if that's the case, then we can reconstruct them. How we can reconstruct them? If you have any of your records, we can resubmit them to NPRC or even to the Department of Veterans Affairs in your case. Now, I know a lot of veterans don't keep a copy of their records, but it's always nice to get, if you do get a copy of them, hold on to them for dear life. If you know of anybody getting out, tell them to get a copy of their records and hold on to them for dear life. Correction of records. We can offer a correction of records. We don't do this too much in our office anymore because we're over inundated with the other programs which we mentioned before. Generally now I just tell the people how to do it, and this is one of the few programs that I hand them the packet and tell them good luck. The success rate in getting the correction of records, if it's a dishonorable discharge and getting it upgraded, or other than honorable and getting it upgraded, the chances are very slim. I've actually sat in several classes with the colonels and generals who make the decisions, and they said it's about a 50-50 chance. It depends on all the information that you turn in with it, and I have a complete pack of information that will really help your chances in getting that added on. You can also add on medals and ribbons that were not put on your DD-214. So if you were awarded a Purple Heart but it was never put on there, but yet you have a citation for a Purple Heart, we can actually turn that documentation in and have that Purple Heart awarded onto your DD-214. So there are other things we can do besides getting a discharge upgrade added on there. And those we've been very successful getting medals and ribbons added on. But the discharge upgrades are very difficult to win. Miscellaneous information. Here's some really cool things for the state of Nevada which we can actually do. If you are 60% service connected and up in the state of Nevada, you can apply for your property tax exemption, and you apply at the county assessor's office. You take a copy of your disability letter to the county assessors, and they take a assessed value off of the assessed what the the county assessed your property at. And I was talking to a vet the other day that I had 100%. He got 100%. Took his letter into the VA or to the county assessor's office. They took his income off of his property tax. He pays $36 in property taxes this year. It can be very lucrative. From what I've seen, about a 60% rating on a $1,200 a year property tax will lower you about $400 a month or a year. So you'll get about a $400 savings. So it's very worthwhile in the turning in. If you're 50% service connected, you can get a hunting and fishing license free of charge, but you must be a Nevada resident for 6 months. So there's little things that, kind of tickle the fancy. You do have to go to Las Vegas to get it, thank you, or probably up to Reno, for that'd probably be closer for those up in Tonopah. And you have to go to the Division of Gaming, Wildlife and Gaming, and turn in a copy of the letter. But you do get that free of charge every year. With your tax exemption, if you are a wartime veteran but you do not meet that 60% disabled, you actually do get a wartime veterans discount, and you can apply at the county assessor's office. And that's usually about $96 or $98, and you can either get that off of your house or you can get it off of your car. So you can use it on either one. And the assessor's office is usually pretty good at telling you which one is going to be in your best benefit. You can also file your documents at the county. Actually, that's not this slide. We can also request in our office, if you're filing for service connection, for your birth certificate, divorce decrees, death certificate, marriage certificates from the courthouses. And generally I help point you in the right direction on that. And what the key to that is tell them that you're filing for VA benefits. And when you tell them that, they usually give you the paperwork for free. where normally some of these courthouses can charge you up to $25 per page. And when you're adding on a dependent, they need both divorce decrees and death on both sides of previous marriages. So if you've been married 9 times and you have to go after 9 divorce decrees, and there are 10 pages each and $25 a piece, do the math. So we can get those free of charge and probably save you a lot of money. This is what the annual exemption renewal card looks like. It's about a 3x5 card. It comes in the mail to you. If you do not turn this card in, you do not get your tax exemption every year. So when you get this little blue 3x5 card in there, sign it, take it back to the assessors, or put it back in the mail. I personally walk mine to the assessor's office so I know it got there. I ask for a photocopy and the signature so that I know I got proof that it got there. Oh, error. I got an error. Don't send. Cancel. I know. Marines are good at breaking things. Isn't that what you just said? Yeah. Yeah, my programming skills are, like I said, nobody would hire me because I didn't have 5 years of experience. Let's see. It is not working. That's why I'm not in the IT department. That's why I'm in Veteran Services. I'm better at filling out forms. I can type on a keyboard. Maybe. Okay. Well, this is freaking out on me. Let's see. While that's freaking out on me, I'm going to go over here and show you real quick. This is the Department of Veterans Affairs website. And this is where you can tell where your veteran service officer, if they are accredited. You can also find out if an attorney or a claims agent is also accredited. So if you want to do your homework and your background on your current service officer and find out if they're accredited, you can do it right here on this website. It's on my county website, which I'm going to show you here in a minute. For this purpose, you go to VSO Representative, either type in last name or even by first name or in city. Today we're going to put in city. Just put in Pahrump, and we're going to hit search. Pops up everybody who is actually accredited by the Department of Veterans Affairs in Pahrump. And it lists 4 people. 2 of them are me. One of them, the 2 other people that are on this list are former employees of mine, and one of them no longer even lives in the state. So I'm going to click on mine, and I'll show you what it looks like. Has my name and has my old building address, which is right next door here where I used to be, across from the VA here. And it has all the different accreditations. And to answer your question, I am accredited with Blind Veterans Association. So I'm across the board, so I can find out what's going on with your claim. So here's all the different power of attorneys that I am accredited with. Normally you don't see 16 or 17 accreditations. You see 1, maybe 2, if you're lucky. Tonopah, call us back. I don't know if they can hear us. It's not just me, it's the Navy too. I don't know if Tonopah can hear me or see me. If you are, we can continue. We've got it on tape, so you can watch it at a later date if so. This is a copy of the Nye County Assessor's exemption for the DMV. So this is what the sample looks like, and you check the block and to get it on your vehicle or your for your vehicle exemption. Hey, welcome back, Tonopah. Thank you. Thank you. We're bringing back the information screen that shut down on me. There we go. Now we can continue. This is the copy of the Nye County Assessor's exemption list for the DMV. So if you have that wartime service, they're going to give you a sheet that looks like this to take to the DMV to get your tax exemption, tax break on. This is another cool thing that you can do, and this is not just for disabled veterans, but for anybody who has a disability. It's called the America the Beautiful card, or the old card is called the Golden Access Pass. It gets you into any national park or federal recreation lands for free. So what you do is take a copy of your disability letter. The closest one here in Pahrump is Red Rock, as you're going through the Red Rock Loop, and take it to the information center. Or if you're going to Death Valley, you take it there and get your card, and they give it to you free of charge. And as you can see, it's an $80 value, and it can be a zero. Yep, and it's not only for veterans; it's for anybody who has a disability. How you doing? It's taking a lunch break. Hey, there we go. So this is an $80 value that you can actually get. Welcome back, Tonopah. We're closing up, so we're in the closing segments here. So hang with me if you can. There are also disabled parking privileges. You can get the from the DMV. There's the Marine Corps League, Army plates, disabled veterans plates for 100% service connected. If you have a Purple Heart, they have Purple Heart plates. They also have recording fees, so you can actually take your DD-214 and record it at the county recorder's office. However, this is a public state, so if you put your DD-214 at the county recorder's office, anybody can access that. And most of the time it has your social security number and all that information on there, so if you put that on the record, as they tell you to do, in case there's a fire in your house, anybody can access that and gain information to your DD-214 and the information that's on it. Just wanted to throw that information out there to you. It is something you can do in the state of Nevada. You can get civilian service preference points for a veteran with a service-connected disability, and the way that works is if you're going for a state or government or a federal job, and you and the other person are equal playing fields and test equal across the board, they have to give you 5 or 10 point preference and hire you over the other person because you are a disabled veteran. That is the way it is supposed to work. A program that not a lot of people know about, but I've taken advantage of here, and it is really awesome. It is called the High School Application. Back in World War II, Korea, and Vietnam, most of the time you didn't have to have your or your high school diploma or a GED to get into service. You could have an 8th grade education and get into service. They would take anybody willing to go. So you just had to be a body. And so what they are doing, if you have an honorable discharge and you never finished your college or high school education, you turn in an application, the state of Nevada will give you an honorary high school diploma. And it is actually a high school diploma. So when you go and apply for jobs or go for anywhere else and they ask you what is your education level, you can actually check high school graduate. Very nice, very cool way to respect those who came in and served their country and sacrificed and leaving and not finishing their education. Here's some web information on how to get a hold of us, how to get a hold of the VA, some of the web pages that you may actually use on a regular basis. Most of these should be in the pamphlets that I've handed out to you. If they're not, I can actually get them to you, and they should be on the county website as well. Here are some more with life insurance, voc rehab, and all the training and everything that we just discussed. Important phone numbers. Obviously at the very top, how to get a hold of me. On that packet that you have that was handed out up in Tonopah and to you has my business card on it, blown up in big pretty colors. It has my telephone number on there and fax number. Because it is only me in the office and a volunteer staff, it may take several days, sometimes up to a week to return a phone call. I do return every phone call, but it can take some time. I do return emails. It does take some time. That is the best way to get to me, because sometimes I have email when I'm down in Vegas waiting for an appeal for 3 hours, and I can return an email quicker than I can a phone call. So that is the preferred method of getting a hold of me. What do you need to bring in for your appointment to see me? This is what everybody's probably been waiting for here. You need to bring in at least this very minimum information. Your DD-214, a DD-215, which is an amended DD-214 if one has been amended. For the World War II veterans, they called it a WD form back in those days. And it was just a certificate, and on the back it had your service dates when you went in and got out. We need a current diagnosis from your medical doctor if you're trying to file a claim for service connection or even for non-service connected pension. We need all medical records from your military service. So the first thing you should probably do is go and file your records to get your records from NPRC. And the veteran, I would like them to go through and find all of the sick bay calls, all the problems that happened in service, and mark those so when they come into my office, they're already prepared. They already know what's in their file. It'll help me out tremendously instead of bringing in a 3-inch stack of paperwork and dropping it on my desk. So here you go. And this is a team. We have to work together. You have to have some time invested in this as well. To contact me, you call 751-6372, and we also have a new 800 number. My email address is kshockley@co.nye.nv.us. It's again on that front page of that business card. I'll show you the 800 number here in just a moment. This is a very good reference tool for any veteran who is interested in finding out the ifs, ands, or buts about the veterans' benefits that we talked about today. It's called What Every Veteran Should Know. This is what the book looks like. This is the old 2007 version, but they make one every year. It is $20, or actually it's about $23 now, I believe the new edition is. You can get that online at Vets Info Service. You can get it on Amazon or Google or any of those sites that you can buy it on, or in one of the stores. And you can get it cheaper through one of those Amazon sites or one of those sites for cheaper. Good reference to have. How do we get positive results? This is what we need. We need to have a current diagnosis of what your medical problems are today. We need a history of the problem in service or exposure in the presumptive cases. And we need, and this is the very important thing here, we need a link stating that the current condition that you have today is related back to your military service. How do we get that? We get that from a doctor. We get that from fellow service members. We can even get the documents from service. We can even get a buddy statement from your wife, people that you know that see you and how your condition has changed over the years. There's a lot of different ways. You can get pictures. I've won cases with pictures. There was no proof of them being in country of Vietnam. I won a case with a guy leaning on a sign that said Da Nang. Okay, cool. We turned that into the VA. I think that's pretty good proof. And we won the claim. So we can definitely win it. The 800 number for those who do not have long-distance telephone is 888-924-4308. And for those up in Tonopah, we actually have video teleconference now. And I can talk to you one-on-one. My office is now not at Nye Regional Clinic anymore. It is at the Health and Human Services. And we have a dedicated office there, and we can sit one-on-one. I have headsets. Each ear is adjustable. If you're hard of hearing in one ear or the other, we can adjust the volume in either ear. And then we can sit down and talk, and I can type up all the paperwork as we talk, fax it up to the office up in Tonopah, have you sign it, and they fax it right back down to me, and we can get the paperwork done in 30 seconds on a phone call versus having me drive up 3 hours one way and 3 hours back. That way I can service more veterans in a quicker time frame. Thank you for your service to our wonderful country. These are the benefits that you've earned for putting your life on the line to defend the freedoms of the United States of America. Do not hesitate to get your benefits. You've earned them. So at this time, I'll take some questions, and then I'll show you a couple of the PowerPoint presentations if somebody wants to stick around on how our Veterans Services works and our county website. Thanks. Come on, if you want to come up to the mic, please. Up in Tonopah, too, if you have questions, you can come up to the mic, too. Push the green button light.
My question is for reimbursement for burial and any like headstone and things like that.
Yes, sir.
If you have a living trust and you use your executor pays out of your living trust, will the VA reimburse the living trust?
They will not, because that money has come out of a trust or a burial association or something of that nature. They will only pay out-of-pocket expenses that has been paid by a family member. So if you have money set aside for your burial, they will not reimburse that because that money is
No, that's not the question. The question is, you have a living trust.
Correct.
And you have a checking account for a living trust, and you have a trustee or an agent. She writes the check from the living trust. See, it's your money, and they're going to pay for it, and will they reimburse the living trust?
I don't see why they wouldn't. I would say let's file the claim and let the VA decide on whether or not that it's a legitimate claim. I don't see why they would not.
Well, I'm not dead yet, so we're going to file a claim.
Well, don't go rushing on me either. I don't want you to go anywhere.
Thank you.
Up in Tonopah.
Yes, like a month or two ago, I called your office, and they forwarded me to wherever the VA appeal office is. I called them up, and they basically said my appeal is in the works and got the same old shuck and jive I've been getting from the VA for the past 30 years.
Okay. What's your question?
What's going on? I mean, are they just shuffling my case down and ignoring it as they generally do, or what?
That is probably not the case. What happens on an appeal, for those left in the room, when you file an appeal, get in the trenches, you're in for the long haul. One of my personal appeals, and this is my personal case, and I'll talk about my personal stuff, but it took 6 years and 3 months to decide the claim.
Wonderful.
So, and that was from the time that they denied the claim and I filed the notice of disagreement. What usually happens is from the time you file the notice of disagreement, it takes on average of about 2 to 2.5 years to get in front of the law judge. The law judge then takes everything is transcribed into notes and goes back in front of the law judge. The law judge reads the entire file, including the documents and the testimony that we gave to the law judge. They review that, and 90% of the time they put it in what they call remand status. because now that we've given them new and material evidence, they have to go back and find more information on the claim, which then goes back to the regional office, and they have to develop more, which is going to take another year or so for them to develop the claim to get the information they need. Once they get the information that the judge requested, it goes back to the judge to make a determination. Once the judge makes a determination, yes or no, yes, it is granted. Let's say it is favorable. Then it goes back to the regional office to find out at what disability percentage they actually are going to rate you at. So it's back and forth, and it's very, very time consuming. I don't think that the cases that they're giving you a shuck and jive. I think that right now today they have over 1 million cases in backlog in appeals alone. So they are very overwhelmed, and it's just the nature of the beast that it's going to take many years to get your reply from the time of your actual hearing before you get your results back.
All right, thank you. About what I expected.
Green button. Push the button. There you go.
Yeah. When you said they take your case and put it under the bottom of the review file?
Yes, sir.
Now, will they go back and get information from the VA medical at the date they're making that decision?
They're supposed to. And if you tell them that you've been treated by a VA medical facility and the dates you were treated by it, the VA is mandated by law to get those records. So if you told them, yes, I am a VA patient, I've been treated by the VA in Pahrump from 2001 to 2007 for condition XYZ, they now are obligated by law to go to Pahrump VA clinic and get the medical records from 2001 to 2007 for XYZ conditions. If you fail to notify the VA that you've been treated by the VA, they're not going to know that you've been treated by them. And here's another example of that. There's 3 different departments in the VA. There's the cemetery side, which we've talked about today. There's the benefits side, which we've talked about, and there's the health care side. None of those sides talk to each other. So if you change your address at the benefits side, tell them that you've moved to Arizona, but you don't tell the VA health care, they're not going to know that your address has changed. You have to change them in all 3 places, and vice versa. None of them talk to each other. So that's one example of how, I guess, screwed up the system is.
Okay, they said they were going to go ahead and review my claim with the evidence I sent in. How do I go ahead and make an addendum to it so they will include the recent VA?
Okay. If you are my client, I can help you do that. If you are not my client, we can probably establish clients. And if you would like to continue on your own, I can help guide you on that. Basically, it's on a 4121-4138. It's basically a blank piece of paper, but it's a VA form. It's a blank piece of paper that just tells them, and you hand write in there or type in there what you want to say. And I would like to submit new evidence. I've been treated by the VA at such and such facility at such and such time for such and such condition. Please consider this for my claim.
No, I had made an appointment with you on October, I think.
Okay.
Is that still in effect, or
Yes.
was that
Yes.
canceled out with
Nope.
this? No?
Nope.
Okay. Thank you.
Yes, sir, up in Tonopah.
Good morning, sir.
Yes.
Can you tell me how to initiate a non-service connected pension claim?
Absolutely. We need to establish first. Let me go back here to grab my slide here.
Sure. And is it more expedient for me to come to Pahrump to do it?
Absolutely not. I can give you the exact same service in Tonopah that I can give you here. We can do it all by video teleconference like we're doing now, except it would be private in my office. And I can do it all on my computer and fax the paperwork up to the office up in Tonopah and have you sign it right there.
Oh,
No need for you to travel.
All right, so that's at the Office of Health and Human Services?
Yes, sir.
Okay.
Okay. I brought up my slide here. Yes. Okay, non-service connected pension is for wartime veterans who have limited income. If you're not over the age of 65, we have to show that you are permanently and totally disabled, which means a doctor has to say that you cannot seek and hold gainful employment because of a disability. It does not have
66.
Okay, then we don't have to prove permanent and total because you have the age factor in your favor. Now we have to meet the income requirements. And the income requirements are all household income. So if you're a single veteran, they go count all of your income, Social Security, retirements, 401k, spouses, gambling winnings. Right now, for a single veteran, it's $11,833 per year, which is about $985 per month. So if you make more than that, that's going to disqualify you for a single veteran. If you're married, it goes up to $15,492 per year.
I qualify.
Okay. Then definitely give my office a call here, and we'll set up an appointment to video teleconference with you, and we will definitely get together and file this non-service connected pension.
All right, sir. Thank you.
You're very welcome.
Thank you. The only thing you don't tell it is be proactive on your claims. That's one thing you forgot to say. Be proactive. It took me 5 months, but I got mine in time. 60%.
I'm trying to get people out of it, then I'm going to pass them. I can talk all day.
So it's something about an Agent Orange registry. How do you get on that registry?
Agent Orange registry. How do we get on? Okay, I've got the information. The way I tell my Pahrump and Tonopah residents is to call the Agent Orange registry and tell them that you live in Pahrump. And that way, because they don't schedule appointments, it's first come, first serve. But I usually tell the Pahrump and Tonopah residents to call first to make sure that they're in the office. Because if they call out sick and you drive all the way from Tonopah and Pahrump down there, you've just wasted an entire day of driving and gas, and they're not even there in the office.
That office is in Las Vegas?
It's in Las Vegas at the North Clinic.
North Clinic?
Yes.
So call them for appointment to get on the registry?
You can call them. You can call the general telephone number, which is 702-636-3000, and then push 0 for the operator. When the operator comes on, tell them you want the Agent Orange office, and they'll direct you right to the Agent Orange office. And you're going to need to bring your DD-214 or anything that shows that you were in country or exposed to Agent Orange. And once you bring that documentation with you, they'll set you up. And usually, for anybody in Tonopah or in Pahrump, if you tell them you're in Pahrump, they'll set you up for the labs and the examination on the same day. Because normally what they'll do is they'll do labs one day, and then they'll do exams another day. But if they know that you're traveling any long distance, they'll set them up on both on the same day. So I try to at least alleviate that.
So I've been seeing a VA doctor for the conditions, so I need to just tell them that I was at a VA doctor when I get down there?
Yeah, you can definitely tell them that you were being seen by the VA doctor. They're going to do their own independent testing on you to do the lab work and their own physical exam and do their own findings, because they're separate from your doctor that you're seeing by the VA now.
So I don't need anything from my local doctor to take with me?
You should not know.
How do you request medical records?
From the NPRC, from your service? We have the form. We have the hard copy forms here, and also, let me see here. On my website here, there's look up on the screen there. There's a video. I don't know if you have internet or not, but there's a video on how to actually order your military records. Okay. So you click on that link, and it'll walk you step by step through on how to order your records online, or you can just fill out the hard copy as well.
Thanks for your time.
You're very welcome. I hope to see you soon.
Just call your office for an appointment?
Yes, sir. That'd be the best way to do it right now. Yeah, once you get all the documents in hand, call my office and we'll schedule you for an appointment.
Just have a question. Is there any paperwork I can get regarding the burial? No, that's shown.
So if I call, which I called a couple times earlier,
We don't fill that out until the veteran passes away.
when you guys coming back,
You can't pre-fill that out.
Our contractors, they read that quote 10 years ago.
Right, so make sure you know what those are.
Oh, yeah.
State count.
That time, you know, the information is a little bit different than it is now.
Yeah, definitely. Yes.
Thank you. Anyway, so why not?